Hello, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for the medical management of chronic kidney disease. In this video, I'm going to speak about the medications that are helpful for people with chronic kidney disease. I'm specifically focusing on people with chronic kidney disease who are not yet on hemodialysis. Tip number 1. Let's first define what chronic kidney disease is. Chronic kidney disease I'll define as having a glomerular filtration rate, also abbreviated GFR, of less than 60. This is a calculation that's done on a blood sample, and your doctor can do it easily. So if your GFR is less than 60 and you have two separate measurements that are 3 months apart, this is the definition of chronic kidney disease. Tip number 2, the evaluation of chronic kidney disease and the monitoring. So if your doctor determines that you do have chronic kidney disease, there are some tests that are useful for diagnosing your chronic kidney disease and for managing it and continuing to monitor its progression. Your doctor is going to check a urinalysis to look for protein, among other things, and may decide to order an ultrasound of your kidneys to determine if if the urine is being blocked from leaving your kidneys, or if there are any other abnormalities that can explain why you are having chronic kidney disease. There's also important monitoring to be done when you have chronic kidney disease. It's important to have your blood pressure checked regularly, to monitor your glomerular filtration rate to determine the severity and progression of your chronic kidney disease, to look in your urine for protein on a regular basis, to monitor your calcium and phosphate in your blood, to monitor the PTH or parathyroid hormone, to monitor your vitamin D level, and also to monitor your hemoglobin or your blood count. So tip number 1 was defining chronic kidney disease, and tip number 2 was lab tests and imaging that are frequently done to diagnose and monitor chronic kidney disease. Tip number 3, blood pressure control. Blood pressure control is very important in chronic kidney disease, not only because it protects the kidneys, but it protects the heart. And people with chronic kidney disease have a higher risk of having heart problems. The goal for people with chronic kidney disease is a blood pressure less than 130/80. This is lower than the goal for everyone else, which is 140/190, over 90. So the goal if you have chronic kidney disease is to have your systolic blood pressure less than 130 and your diastolic blood pressure, the bottom number, less than 80. There's 2 ways to do this, and it depends on whether or not you have edema or fluid overload. If you are fluid overloaded, the best way to control your blood pressure and to lose the extra fluid is a loop diuretic, most commonly Lasix, which is the number 1 medication to take to control blood pressure if you are overloaded, if you have swelling. If you don't have swelling, then the number 1 medication to use is an ACE inhibitor, angiotensin converting enzyme inhibitor. A common example is lisinopril. And this is the most effective medication to lower your blood pressure if you do not have swelling. Your doctor can make this determination and choose the medication that's right for you. Tip number 4 is proteinuria, less than 1 gram per day. So tip number 3 was a blood pressure less than 130/80. Tip number 4 goal is less than 1 gram of protein in your urine per day. This can be measured by a spot sample of your urine to determine the amount of protein in it. If you do have protein in your urine, the most effective medication for lowering this protein and getting to your goal of less than 1 gram per day is an ACE inhibitor, angiotensin converting enzyme inhibitor. An example, once again, is lisinopril. Your goal is to keep your protein in your urine less than 1 gram per day. So tip number 3 was keeping a blood pressure less than 130/80. Tip number 4 was keeping your protein in your urine to less than 1 gram per day. And tip number 5 is keeping your bicarbonate in your blood to greater than 23. If your bicarbonate is less than 23, your doctor will start sodium bicarbonate, which you'll take orally to keep your sodium bicarbonate level above 23. So tip number 3 was blood pressure less than 130/80. Tip number 4 was protein in your urine less than 1 gram. Tip number 5 is keeping your bicarbonate greater than 23. Tip number 6 is to keep your phosphate less than 5. Phosphate is a element that will increase during chronic kidney disease because your kidneys have trouble getting rid of it. It's important to take a medication to lower your phosphate if your phosphate is greater than 5. Sevelamer is one of the best options for getting phosphate out of your body if your phosphate is greater than 5. It's a medication prescribed by your doctor, usually starting at 800 milligrams 3 times a day. And the goal, the specific goal, in general, it's a phosphate less than 5. But for less severe chronic kidney disease, the specific range for normal phosphate is 2.7 to 4.6. If your kidney disease is more severe, then the recommended phosphate goal is 3.5 to 5.5. Your doctor can tell you what your phosphate goal is based on your glomerular filtration rate. Tip number 7 is keeping your 25 hydroxy vitamin D level greater than 30. This is a blood test to measure your vitamin D level. Chronic kidney disease can cause bone loss, and it's important to keep your vitamin D level above 30 in your blood. So your doctor will check your 25 hydroxy vitamin D level, and it's important to take vitamin D supplements, specifically ergocalciferol, if your 25 hydroxy vitamin D level is less than 30. Usually the dose of ergocalciferol is 50,000 international units per month for 6 months, and then repeating your vitamin D level to make sure you've reached your goal of greater than 30. So tip number 3 was lowering your blood pressure to 130/80. Tip number 4 was keeping your protein to less than 1 gram per day, and preferably no protein at all in your urine. Tip number 5 was keeping your bicarb greater than 23. Tip number 6 was keeping your phosphate to less than 5. Tip number 7 was keeping your vitamin D level greater than 30. Tip number 8 is keeping your hemoglobin, or your blood count, greater than 10. Your kidneys produce erythropoietin. Erythropoietin tells your bones to make more blood. When you have chronic kidney disease, your kidneys are not able to make erythropoietin the way they should. And so a lot of people with chronic kidney disease can develop anemia, which is a low blood count, a low hemoglobin. However, it's not recommended that you treat just mildly low hemoglobin. It's only recommended that you treat a low hemoglobin if that level is less than 10. So if your level is hemoglobin less than 10, then your doctor should treat you with erythropoietin, as well as iron. Iron supplementation is also important, and it's important to make sure that if you're starting erythropoietin supplementation, that you keep adequate iron stores in your body. So if the hemoglobin is less than 10, your doctor most likely will prescribe, usually as a starting dose, erythropoietin 10,000 units. It's a subcutaneous injection, and it should be done weekly. Also, your doctor should evaluate to see if you have enough iron. If you are being treated with erythropoietin, it's important to keep your transferrin saturation between 20 and 50%. and your ferritin level between 100 and 500. In other words, if you're being started with erythropoietin for a hemoglobin less than 10, you should also be given iron supplementation if your transferrin saturation is less than 20% or if your ferritin level is less than 100. Tip number 9 is keeping your LDL, which is a measure of the bad cholesterol, to less than 70. So kidney disease is an equivalent to having a history of heart disease in terms of your future risk of a heart attack. So if you have kidney disease, you're as likely to have you're approximately as likely to have a heart attack as someone who actually has had a heart attack. So it's very important to keep the bad cholesterol level low, and I recommend keeping your LDL level to less than 70. The most effective medication to do this is a statin. So your cholesterol should be checked, and your doctor, and you should discuss with your doctor starting a statin medication if your LDL is greater than 70. So just to recap, the medical management of chronic kidney disease before you reach dialysis are the following: keeping your blood pressure less than 130/80, keeping the protein in your urine to less than 1 gram per day, keeping your bicarbonate to greater than 23, keeping your phosphate level to less than 5, keeping your vitamin D level to greater than 30, keeping your hemoglobin to greater than 10, and keeping your LDL to less than 70. I've discussed all of the medical management of chronic kidney disease before you reach dialysis. There are important other considerations which will be covered in other topic reviews, and they are the lifestyle management of chronic kidney disease. A lot of these medications can be avoided if you make lifestyle changes, especially changes in your diet. This video was focused specifically on the medications that are important to take if lifestyle changes are not effective at reaching the goals that I described. I also haven't discussed the preparation for dialysis or recommendations for people who are on dialysis. Dialysis being recommended if your kidney disease becomes severe. And tip number 10 is to believe in yourself. Chronic kidney disease has many different causes and is very common. There are many effective ways to determine your health and to set goals for your health when you have chronic kidney disease. I've discussed the important parameters that should be monitored when you have chronic kidney disease and what medications can effectively reach specific goals that you should strive for when you have chronic kidney disease. This video is intended to give you more information so that you're better prepared when you speak to your doctor about your chronic kidney disease. I hope these tips have been helpful. Thank you very much for listening, and have a great day.